I'm just trying to... Hello. Hello? Can everybody hear me good? Okay. I'm just typing in the comment to pin and give me one moment and we can get started. I have a nice topic for everybody today. Something that's very interesting and informative all at the same time. Give me 1 second, y'all. I'm almost finished. People, give me 1 more second. Okay. Hello, everybody, and happy International Women's Day. Let's get started. During the past few months, Whitman-Walker Community Health Department has expanded its efforts to social media platforms. We cover various topics about HIV and STI, sexual health practices, access to care, social determinants of health, and public health interventions. The community health team is here to educate and support you. If you all can comment and share, be interactive as possible, that would be great. Hello, my name is Corey Haskell. I use he, him, his pronouns, and today I will be discussing chemsex in the LGBT community, in addition to factors and links when it comes to STI and HIV transmission. What is chemsex? Chemsex means using drugs as a part of your sex life. So, for the most part, there are 3 main drugs that I'm going to be referring to today, but chemsex is more common in gay and bi men. There's definitely 3. There's 3 specific chem drugs that people use. People tend to say that these drugs make them feel less inhibited and increase pleasure. The 3 main chemsex drugs are methamphetamine, methadone, GHB, and GBL. Methamphetamine. Methamphetamine is a stimulant. It's also known as crystal meth, Tina, or crank. In the gay community, a lot of times people call it Tina. People take crystal meth by swallowing, snorting, injecting, or smoking it. It makes them feel alert and aroused, but it can also make them feel agitated and paranoid. So that's not good during sex, of course. Methamphetamine can raise your heart rate and blood pressure, which can lead to heart problems. There has also been reports of psychosis from taking methamphetamine. There is evidence of long-term mental health problems and brain damage. You can die if you overdose. It's a highly, highly addictive drug as well. Methadone. Methadone is also a stimulant. It is known as meth, drone, or meow meow. People usually take methadone by snorting it, but you can also take it by swallowing it and smoking it or injecting it as well. It makes you feel alert, aroused, confident, and euphoric. It can make people feel sick, anxious, and paranoid as well. Methadone can make you vomit or give you a headache. It can cause hallucinations, insomnia, and a reduced appetite, dizziness, and sweating. It is also highly addictive. GHB or GBL, they're sedatives. Their full name, it's a super long word, gamma hydroxybutyrate, are also known as Gina, Jeebs, or liquid ecstasy. GHB or GBL are usually an oily liquid that is usually mixed with a drink and swallowed. They usually use Gatorade or some form of um, hydration system like water or Gatorade to swallow this. Um, they make people feel euphoric, less inhibited, and sometimes very sleepy. So it's kind of a little bit of a date rape drug as well. So you have to be careful with this. With GHB and GBL, it is difficult to know how much of the drugs are being taken, so it's easy to overdose. This is like one of the main chemsex drugs that people overdose on because of it's such a easy. It's so easy because of a lot of times people don't know how much of the drug they're ingesting. They mix it with something like again like Gatorade or water, and then they're taking it. And once they start to get high, they don't know how much of the drug they're taking anymore. They're just still just drinking out the bottle, which usually leads to an overdose. Is chemsex safe? While there are always ways to keep yourself safe, there are some risks involved. Injecting drugs is risky. Of course, we know that. Sometimes people inject or slam crystal and methadone. Um, with this, there's an increase of injector-related infections or blood-borne viruses like HIV, hepatitis C, or hepatitis B. It can lead to unsafe sex, of course. If you're under the influence of drugs, you might not use a condom, which can cause you to put you at risk of HIV and other sexually transmitted infections. People who are higher on certain drug who people who are high on certain drugs will often have rougher sex than usual, which can cause bleeding. Of course, blood is one of the five bodily fluids that can transmit the virus. Is this all new information for people or did some of the people that are viewing knew about this stuff? Chemsex drugs can change how you feel or behave. When you mix them with sex, you increase your risk of HIV and sexually transmitted infections in a number of ways. With fewer physical inhibitions, you're less likely to use condoms. Again, it's fairly new. Yeah, a lot of people don't know about this, but it's an increasing thing, especially in the Black and brown community right now. It's an increasing. Um, I wouldn't call it a pandemic, but it's an increasing thing. It's new to you as well. Yeah, chemsex is something that is it's turning into a huge factor in the Black and brown community. It has been something in more of the Caucasian LGBT community, um, but it's like now it's starting to turn into a big thing with everyone. And this is another thing. You may not remember what you have done or whether you used a condom. So if a lot of times if you are mixing drugs and sex, once you get to that place, you probably don't really too much remember if a condom was used or not. During a long session, you might forget to take your prep medication. You might making you more vulnerable to HIV if you're not using a condom. Again, if you're high, taking prep is probably not on your mind. Taking your meds are probably not on your mind. If you're living with HIV, you might forget to take your HIV medication. Again, a lot of times these drugs will keep a person up for days because it gives you a euphoric feeling. It gives you a lot of energy. You may have sex with strangers. You may have more forceful sex because of the aesthetics effects and during like drugs like GHB. You have a particularly long sex session, you may not think about assessing emergency, PEP or anything like that. So again, all of these things are like mind altering. So while you're high on these drugs, a lot of the time you won't be thinking about, um, if you exposed yourself to anything, if someone exposed you or you exposed someone else to something. It's like, other words, it's like a party and play scene. A lot of times, if you are on these social websites or apps like Jacked or Adam for Adam or whatever, um, you will see people will message you and say, "Do you party like in it like with a capital T, or do you party and play or P and P?" So basically, that means that they're asking you if you participate in chemsex drugs. Okay, so you may inject methadone or crystal meth with shared needles, otherwise known as slamming, increasing your risk for both HIV and hepatitis C infection. Again, this is another thing that is also a risky behavior. If you are slamming Tina, if you're slamming methadone, um, and sharing needles with someone else, you are putting yourself at risk for HIV as well as hepatitis C infection. The drugs used in chemsex also have other health risks. It is easy to take too much GHB. Again, once you're high and you're taking the GHB, whatever you choose to mix it with, you no longer know how much you're taking at that time. This can cause you to pass out, leaving you more vulnerable to sexual assault. Whether the circumstances of whatever the drugs you have taken, remember the sexual assault is never acceptable and it's never your fault. Chemsex drugs change how you feel. Sometimes it's unwanted. They can make you confused, paranoid, frightened, and in some cases, you can lose touch with reality and have very convincing hallucinations. Again, these drugs usually keep people up for days at a time. It is also common for people to have a come down after a chemsex session where they feel depressed or low. Certain anti-HIV drugs have been known to interact badly with chemsex drugs. In particular, there have been cases of death resulting in interactions crystal meth and Ritnovar. Ritnovir. I think that is one of the actual things that are in one of the medications. Excuse me, my allergies are acting terribly. Ritnovir. Yeah, I really, I just want everybody to just be safe, especially when it comes to if you are participating in this subgroup, just be safe. Um, really take the time to really just take the time to protect yourself at all costs. Use protection. Um, Test your drugs. Fentanyl is a huge thing right now. They put fentanyl in just about everything. Test your drugs. Play responsibly. Um, and it's just all about harm reduction. We're never here to judge anybody. If you need help, again, there Whitman-Walker is here to help you. There's mental health counseling, there's testing. But thank you all for watching. Again, happy International Women's Day. Before we go, I want to give you a few reminders about COVID-19 and the vaccines. If you have already gotten vaccinated, congratulations. Of course, thank you so much. If you've already gotten vaccinated, congratulations. You have taken a really important step to preventing yourself, your loved ones, and communities from illness. The Delta variant is soaring across the United States at the moment, and it is totally understandable why you might want to keep wearing your mask. The vaccine is 100% effective. Isn't 100% effective. The more contagious variants are spreading, and there are very few protocols in place to actually verify that folks around you are vaccinated. Keep on staying alert. If you haven't been vaccinated and you're looking for an appointment, Whitman-Walker Health has COVID-19 vaccine available. Everyone ages 12 and up are eligible to receive the Pfizer COVID-19 vaccine, and everyone ages 16 and up are eligible to receive the COVID-19 vaccine. Please reach out to us at 202-207-2480. That's great. Yeah, me too. Like, I really didn't play with it. I was one of the first in line, to get it. I think it's best, in my opinion, to be vaccinated. But if you aren't, to each his own. So make an appointment. If you're having trouble making an appointment with us for DC residents, you can find information on COVID-19 vaccine walk-up locations and eligibility at vaccine.dc.gov or by calling 1-855-363-0333. Track the spread of COVID-19 vaccination lines by visiting coronavirus.dc.gov/don't wait. For Maryland residents, learn more about the Maryland vaccine distribution process and schedule a vaccination appointment at covidlink.maryland.gov or by calling 855-634-6829. If you live in Prince George's County, visit their vaccination registration portal here. If you live in Montgomery County, visit their vaccination registration portal here or call 240-777-0311 to schedule an appointment. For Virginia residents, learn more about the Virginia vaccine distribution process and schedule a vaccination appointment at vaccinate.virginia.gov or by calling 877-829-4682. If you haven't been vaccinated and you're not looking for an appointment, please continue to follow CDC guidelines for mask wearing, quarantining, social distancing, and the like. It is very important that you get the vaccine. Discuss COVID precautionary measures with those around you. Be mindful of masking and keeping your distance, especially when you do not know whether a person has been vaccinated or not. Remember to follow us on IG, Facebook, and Twitter at Whitman-Walker, and checking out our website at whitman-walker.org for the most up-to-date information. On our services and for COVID-19 resources and general Whitman-Walker services, please call us at 202-797-4439. Follow some of our programs at WWH Family and Real Talk DC _ and at No Filter DC. Thank you guys again for watching. Our next live will be on Friday, where I will be collaborating with Jewel. We have a great topic for you all. Stay tuned. The flyer will be coming out, I believe, either today or tomorrow after we finish our script. Again, happy International Women's Day. Everybody stay safe. I hope this information is informative and it's helping the community. And stay tuned for more.